I'm Eric Parker. This morning on CT21, we're seeing a slight rise in COVID cases here in Connecticut. So is it a sign of trouble ahead? Dr. Alberto Ko is talking about where the concerns are and what the Delta variant means for our state. And Connecticut launches a new social media campaign to encourage young professionals that there's a lot to keep them here. We're learning about this CT for Me effort. And a crisis at Connecticut's animal shelters as a number of pets adopted during the pandemic are now being abandoned. A shelter owner shares what she's seeing. It's all ahead this Sunday morning, July 25th. CT21 starts right now.
From Channel 3, this is Connecticut's most watched current affairs program, CT21, with Eric Parker, sponsored by Hartford Healthcare.
Good morning. Over this past week, Connecticut saw an uptick in COVID cases. So is there a cause for concern? What could we be facing this fall? And what about these breakthrough infections that we've been hearing about? Where are those who have been fully vaccinated getting sick? Joining us now is one of the leading voices in our state on COVID, Dr. Alberto Ko. He's a professor of epidemiology and medicine and department chair at the Yale School of Public Health. He's also a member of the governor's Reopen Connecticut team. Dr. Ko, thanks for being with us. I know you're joining us from France, our first international guest on this show. Tell me what people here in Connecticut, though, need to know about where things stand with COVID right now.
Well, thank you very much, Eric, for the kind invitation to come back on to your show. So first of all, that we need to know about COVID is particularly the threat of the Delta variant. This is a variant of the COVID, the virus that causes COVID, which is twice as infectious or transmissible than the viruses that we first encountered back in early 2020. And you can imagine how that really puts a pressure on current public health interventions. In addition, what we do know about the Delta variant also is that at least until now, and we're learning more about this variant each day, but at least now it doesn't appear to be more virulent or cause more severe outcomes such as hospitalization deaths as the previous versions of these variants that we've encountered. And I think the last thing that's important is that this is not what we call a vaccine escape mutant. This is not a mutant or a variant which breaks through more than other strains the immunity created by someone who completes their vaccination course. So the bottom line is that if we keep up good vaccination and have people complete their vaccinations, we're going to do a much better job of protecting ourselves from this Delta variant, which is causing large pandemics or large epidemics throughout the world.
All right, let me just get some quick answers from you for a couple of different populations who could be watching this morning. So if I'm an adult and I'm fully vaccinated, 2 doses or 1 dose if it was Johnson & Johnson, if I'm fully vaccinated as an adult, do I have to do anything differently right now?
Not at this moment, and not from what we've learned. Most people have been vaccinated in the last 6 to 8 months. We know that the responses, the immunity and the antibody responses that we gain from vaccination keep us protected from the COVID virus. Let me just say one thing is that this is, that it's important to recognize that any vaccine is not perfect. And that we're going to have what we call breakthrough infections or breakthrough disease caused by COVID. But we've vaccinated in the world hundreds of millions of people, and the number of vaccine breakthroughs are actually quite small considering the number of people who've been vaccinated.
All right, so let me ask you about another population who could be watching our show this morning, Dr. Ko. What about unvaccinated adults? I think many people who are watching, if they are vaccinated, they probably know some people who, for whatever, have an objection to getting the vaccine and are not vaccinated. So if someone watching this morning is an unvaccinated adult, do they have to change their behavior because of this Delta variant?
Yeah, so that's certainly the group that we're worried most about. These are people who don't have immunity or may not have immunity on board against not only the Delta variant, but all variants or all types of the coronavirus, and they're the ones that are going to be at risk for hospitalizations and deaths from this variant. What we do, what they have to do is, certainly this is a highly transmissible variant that's emerged, that's come into Connecticut now, and they should take precautions, and that includes what we know and tried and true work in the past: face masks, avoiding social gatherings, keeping social physical distancing from others.
Now, how about young kids, Dr. Ko? I'd like to think some young kids watch this program, but I'll be realistic and say it's probably parents we're talking to. So if there's kids under 12 or even younger teenagers who haven't yet been vaccinated, any change in the approach as far as what they should be doing right now?
Yeah, so these are guidelines that are going to be likely coming up and likely evolving. We have introduction of the Delta variant in Connecticut. It's now the major cause of COVID in the state. Surely there, children under the age of 12 haven't had the opportunity to be vaccinated. So we're going to have to keep a close eye. The good thing about this is that, many times the disease is much more mild and in children and has less of a risk for developing kind of the severe outcomes of hospitalization and death in that group. But certainly we're worried about transmission. This is a very highly transmissible variant. And this is certainly something we're going to have to think about when we go into the fall for as schools reopen.
One thing a lot of people saw this week, and you may have seen it, was moving around social media, was a doctor from down south who said she had a patient who was dying of COVID, who said, "I didn't get vaccinated. I thought it was political. I thought it was a hoax. I thought it wasn't a real risk." And the patient knew how sick they were. The patient's family knew what was likely coming. And the doctor said, "I just told them this is why you needed to be vaccinated." Is that a message that the medical community is hearing? Is that people don't really realize the reality of the situation until it's too late?
Yeah, I think that's always an issue in public health. Whereas, when we're thinking about prevention, where the risk is not right in front of your face and it's not directly encountered, and it may be distant and not as pressing. For example, there may not be family members and who have undergone COVID or the devastating effects of COVID. I think we really have to always go back to the facts. We've had hundreds of millions of people in the US, around the world, that have been vaccinated. There are very rare, adverse reactions that have occurred with the vaccines, but the large benefits that have been afforded the vaccines, there are estimates that we've probably saved over 200,000 lives in the US just because of the vaccination program that has already occurred in the last six to 8 months. And that's a really an amazing estimate when you're thinking about 200,000 people that have been saved just because of the rollout of the vaccine in the United States.
Dr. Ko, we only have about 30 seconds left, but I think a lot of people in Connecticut think we're doing so well here and other states are not. So is this Delta variant a concern even in, relatively highly vaccinated Connecticut?
Yes, and I think that's because of certainly the two characteristics: the increased transmissibility, and like all coronaviruses, its ability to super spread, particularly when you have, when you're the increased risk of super spreading in large gatherings. And that, that really means that we have to double down. Our vaccination rates have leveled off, and we have pockets within the states, and particularly in our cities, where our vaccination rates are similar to that in the South. And those are the ones that we have to close up. So I think this really emphasizes the need to double down on the great job that the state has already done on vaccinations.
All right, Dr. Alberto Ko, we asked you here today because we knew you'd break it all down for us. You did just that. We appreciate you joining us all the way from France this morning on CT21. We'll be talking to you again, I'm sure.
Thank you very much, Eric.